an EMO, a 25-year-old male recently brought to you by ambulance, and he was involved in a motor vehicle accident. His GCS is normal. Perform the cranial nerve examination. Explain to the patient what you are going to do. The checklist would involve sympathy, wash your hands, introduce yourself, position the patient, and give adequate exposure to the required part. The general appearance and the vital signs. I am very sorry to hear that you're involved in a motor vehicle accident. How are you? Do you have any pain anywhere in the body? I need to examine you today, which will involve me checking your functions of the small nerves of the brain, which we call cranial nerves. Is it all right with you? Sometimes I will give you instructions and you need to copy my movement. Is that okay? Then we position the patient. This patient sits down on the chair. You look at the general appearance, mention the age and the gender of the patient, whether he's comfortable or not, and seated on a chair. The examiner then may ask you what his vitals are. Then we proceed to do a first cranial nerve examination, which is the olfactory nerve. We ask him, do you have any difficulty in sensing smell? And in case they give you any object for smelling, you need to ask the patient to close one nostril, check it with the other, and similarly close the other nostril and check it with the other. The second cranial nerve examination is the optic nerve. We check three things. One is visual acuity. Number two, visual field. Number three is fundoscopy. For visual acuity, we can present the patient with a handheld eye chart. We tell him, this is a chart. Would you please hold it out with a one-arm stretch? Do you need to wear glasses? Because I would like you to wear your glasses during this. Then you would ask the patient, can you read the last line? If yes, the patient's vision is 20/20. If not, go one line higher. Then we check the visual field. And this time, he does not wear his glasses. And tell him, I need to check your visual field. This is a red tip pen, and I will introduce this from the periphery to the central. When you start seeing it, please let me know by saying yes. Now cover your left eye with your left hand. And we're going to do the same now with the opposite eye. And then we say visual field is normal. Next is fundoscopy. Now I would like to check inside your eye using an instrument called a fundoscope. It's just a device to check inside the eye for the retina. I won't hurt you. Before the examination, I have to add 1 to 2 drops of medication in your eye and examine you in a dark room. Is that okay? So I'm going to check the cornea, the opacity of the iris, the lens for a red reflex, the optic disc to see whether it's clear or whether it's blurred. We can see the macula of the retina and see whether it's normal. Then we say, this is a normal fundoscopy examination. At the time of fundoscopy, the patient might be having pain in response to the bright light that we put inside the eye. So we have to explain that to the patient. Third, fourth, and sixth cranial nerve examinations. That's oculomotor, trochlear, and abducens nerve. That is the lamp, which is light, accommodation, movement, and pupils. Pupils. On inspection, the pupils appear normal. We check for the right light reflex, both direct and consensual. Now I would like to shine the light into your eye, and ideally we need to put a card in between both the eyes so that you shine the torch into the right eye and check for a direct pupillary constriction on the right one and a consensual one on the opposite side. Similarly, we do that for the opposite side. Then we check for accommodation. We ask the patient to look beyond into the distance and then try to focus at a nearby finger of yours. And we see for intorsion, pupillary constriction, and whether the eyes adduct. And we say accommodation reflex is normal. Movement of the eyes. How do we check this? You should say I would like to keep your eye on my finger. I would like you to look at my finger while I'm moving it and follow it around without moving your head and neck. If you have any pain, if you have any double vision, do let me know, okay? So test with an imaginary H line and observe the patient's eye movements for nystagmus. So we need to see up to the right, then down to the right, then up to the left, down to the left. This way we are checking the superior oblique on the right side and the inferior oblique on the opposite side. And similarly the other muscles. Then we also need to check right and left movements for abductors and adductors. The fifth cranial nerve examination, which is a trigeminal nerve. Sensory component. Now I would like to check the sensation of your face. And I'm going to check for pain, temperature, and touch. So this is a thin wisp of cotton wool. And I would be using this to check touch. So can you sense it if I touch your forehead with it? Yes, this is, so do say yes every time you can feel it and you need to close your eyes. So I'm going to compare both the sides and say whether the sensation is normal. So I would check over the ophthalmic division, that's over the forehead, over the cheekbone, which would be the maxillary division, and over the angle of the jaw, which would be the mandibular division. Then I would check for jaw jerk. I would like to tap on your chin with this little hammer to check whether the response is normal. I won't hurt you. It's just a light jab over the thumb. So I tap it and then I see that it's normal. We need to check whether it's normal or whether it's exaggerated. So masseters. We ask the patient to clench his teeth and we check for the tone of the masseters. We also ask the patient to protract his jaw and move it to the left against your resistance and to the right against your resistance. Then we go on to the seventh cranial nerve, which is the facial nerve. Sensory examination would include taste in the anterior two-thirds of the tongue, and this has to be done on either side. You cannot do right in the middle because it has to be on one side first and then the other. And in between checking this side and that side, you need to rinse your mouth because otherwise some salivary drops can go on and contaminate the other side and causing a wrong sensation. What about motor? Motor, we check for the facial muscles. On inspection, we see is there any facial asymmetry? Is there drooping of the angle of the mouth on one side? Are the nasolabial folds equal or not? Then we would ask the patient to look up and checking for the wrinkling of the foreheads. We ask the patient to shut the eyes tightly and say, I will try to open your eyes, but don't let me do it. And we have to see for Bell's sign, which is the eyeball moves up on closing the eye. Ask the patient to smile or show his teeth and puff out his cheeks. Then we say the seventh cranial nerve is intact, or if there's a problem, we mention that. Eighth cranial nerve, or the vestibulocochlear nerve. We check for balance, and we say, do you have any problems in maintaining your balance? And the vestibular component is what is checked. Do you feel like you are in a merry-go-round? We do two tests, a whispering test and an otoscopy for hearing. In the whispering test, now I would like to get back I would like to go behind you and say some numbers. Can you please repeat them after me? You need to hold one ear shut. And then I repeat, 66, 99, and do it with the opposite ear. Then we're going to do an otoscopy examination. Now I would like to have a look at your ears, at especially the eardrum and the canal of the ear, with an otoscope. Is that okay? And then we look for the presence of wax and the status of the tympanic membrane. The ninth and 10th cranial nerves, glossopharyngeal and vagus. So we check for swallowing. We ask the patient to take a sip of water. Hoarseness of voice, What is your detailed address? Gag reflex. We just ask the examiner, can you please open the mouth and say, ah, for me? And the movement of the uvula is checked. That's the 10th cranial nerve. You move it when you say ah, the uvula moves upward and is pulled in the same direction as the nerve. It's pulled up. Okay, but for a gag reflex, there are two components. One is the sensory and the other is the motor component. And you have to actually touch the posterior pharyngeal wall with a throat swab and see the response of a gag. 11th cranial nerve, which is the accessory nerve. Now I would like to check the power of the muscles around the shoulder. So would you please shrug your shoulder? I'm going to push them down, but you try to resist it. Could you please turn your face to the left against my resistance and the other side? Then the 12th cranial nerve. Could you please open your mouth? We check for the tongue at rest to see for any wasting or fasciculations. The tongue should not be protruded. Then we check for the movement of the tongue to the left and the right, to the roof and to the floor of the mouth. And we ask him to push against his cheek on both sides and stick out his tongue in the center. If there is a problem and the tongue is paralyzed on one side or the 12th cranial nerve is paralyzed on the left side, remember that the 12th cranial nerve muscles of the tongue push. So if it's paralyzed, it will be deflected to the same side. Thank the examiner and the role player at the end of the examination.